So why do we need something like positive medicine, which is beyond positive psychology and beyond what we do in traditional medicine? Because what we understand is that health is more than just the absence of disease. And this is built into our World Health Organization constitution. And for doctors, if we're not thinking about our own health as something more than just the absence of our own disease and distress and burnout, we are not going to be asking our patients about these things, because what we know from research is that doctors who smoke, doctors who drink excessive amounts of alcohol, they don't want to feel like hypocrites. So they don't ask their patients about some of these habits. So if we're not doing these things as doctors, as parents, as teachers, as folks who serve as role models for other people, we are not going to be able to usher those things in and bring out the best in those people that we're trying to help. And of course, when we are just demoralized and burned out, we are just trying to survive. We are just trying to secure that base of our boat and plug up all the holes. We can't even think about opening our sail. So what is positive medicine? It is a deliberate and balanced approach to medicine that centers physician well-being as central to optimal patient care delivery. And you can replace physician with nurse, with psychologist, with any healthcare worker, and really translate these principles to anyone who's caring for another human. It recognizes that the absence of disease does not necessarily lead to the presence of health, which is something more, which we'll talk about. That is the perfect question. So we get this all the time. This, I'll get consulted as a psychiatrist because a team won't know exactly. They're like, we think this is psychiatric, but we don't know how to tell the patient this. And we tried to tell them and they got mad at us. And now we have lost we've lost our rapport with our patient, because as doctors, we're taught to think about things that exist in the body and are quote unquote real, and things in the mind that are not real somehow. And that is a totally false depiction of what's going on. So this idea of it's all in my head, we have to squash that. Yes, there are mental factors contributing to your experience of pain, perhaps an over-attention to pain, and that is just as real as any other thing that can go awry in the body. So I think it's really about terminology we use and how we educate what I'm doing is educating clinicians to have some of these conversations, and then so we can educate our patients. So, there is this relationship between how we experience stress in our lives and our pain thresholds. And for anyone have irritable bowel syndrome in the room, IBS? Yeah. So it's not BS. It's an incredibly common condition that is considered a disorder of gut-brain interaction. And it's as though, it's folks get abdominal pain, constipation, diarrhea, and it's often associated with stress. And when we're going through stress, it's not just up here. We have hormones circulating all throughout our body. And that includes cortisol and adrenaline, and that changes the way blood gets shunted to and from our gut, like I explained in the pre-test diarrhea that people have. And so there are physiologic changes going on that are bidirectionally mediated by what's going on in our body and what's going on in our minds. So we experience pain, that sends a stress signal to our mind, something's wrong. Even if it's my knee, it's not my gut. My knee is hurting. I'm not going to be able to walk. Something's wrong with me. It reminds us of our own mortality and frailty. We get stressed. Our ability to reason with ourselves goes down because our amygdala becomes engaged. We become more attuned to the sensations in our body. That drives further stress. It drives further pain. And the pain is real. It's the catastrophization cycle that we can use psychological remedies to work on and help people cope and live with chronic pain. So it's all about how we communicate and validate what you're experiencing is real. And the power of the yes and is that there are still things we can do and are in your control to modify. And that includes the way we're thinking, cognitive behavioral therapy, positive interventions, physical exercise, things like that. So that was an amazing question. If anyone ever tells you it's all in your head, call me. Thank you for being such an engaged audience. Don't hesitate to reach out. Thank you.